The next, we'd like to move to our very last presentation today. I'd like to welcome Dr. Chen. Dr. Chen. Dr. Chen is a professor in Institute of Health Behaviors and Community Sciences at National Taiwan University. She has made significant contributions to understanding health inequalities, obesity, eating behaviors, community-based health interventions, just to name a few. She had an MA in sociology from National Taiwan University, and she has a PhD in sociology from Columbia University in the United States. Welcome.
Director and the students, thank you for your action and support. Still be here, I think it's quite a long day, and of course it's a very interesting day from the morning to the afternoon. And today I'm going to share some study I work with my students. But Linda, it's not for actions, but it's for about community preparedness, readiness. It's kind of laying the groundwork. Okay, so I work. This is the outline of the work through different topic. I'm going to share with you some of the principles of community-based development that we always teach students when they are required to engage in community. And the second, I want to tell you that how the CRM connect, how the principle connect to the CRM. And I'm showing you that we have what is the CRM? And then go to application of the CRM on dementia prevention in Taipei City. And then conclude with some discussion. Okay. I have been teaching community in this college for many years, including college, graduate student and college student. They all require to engage community during your course. So they have to choose one community to engage. And I always tell them there's a framework to engage community. First of all, you have to, ask the resident, including the student itself, they have to have active participate in the project. And then when they finish, when they have some idea, they want to, I ask them to invite the resident or the community leader to talk with them. If they have some skill, they can pass the skill to the leaders or the residents. And most of all, I want them to invite different kinds of the people in the community. Not only the leader, but also probably people walking around the street or people holding the store. Ask them how they feel about the topic you are interested in, or what the problem is. And the last one is you have to think about what you are going to do or to design a project has to be has some long-term environmental viability. Something you have to give the idea that this project is workable. Even the student may not implement the project, but if the leader thinks the project is good, they can adapt the project. And so that the project has to design to have viability. So when they really come to the community, we ask them to put the concept into actions. And there's several things we ask them to pay particular attention. One is the asset-based focus. Go to the community to see, to ask, to interview what their strengths are and what's the assets they might be able to mobilize. And then they have to be cultural sensitive to know when you are, the students are students, and the residents might feel alienated with the student. and they have to have the sensitivity to know their value or their view about our students. Because sometimes NTU students, when they go to the community, and the residents of the community are not so welcome then to come. Somebody say, oh, you are coming to the community to pick up the problem and don't provide solution. They have to have such sensitivity. And always remember to adapt, to change their project. If something they come up with a very nice idea, but the community already have a project going on, they need to adjust or work with. These are the principles that we always teach students to follow when they really engage community. But there's some very smart student will come to me and ask, which community I should choose? And even I already decided to choose this community, what aspect should I focusing on? How can I know the community is better equipped with this, but not with that? So I will tell them, let's do community readiness model to see, each community has unique characteristic. So find out the characteristic, find out the challenge, and then try to come up the project and by talking with the resident or leader in the community. So CRM become a tool, easy tool for students to evaluate that if they're concerned about this issue, whether the community is ready for that, whether they have no idea about the importance of the issue. They are not aware of anything about what you said. Just go away. So this is an evaluation tool. But why CRM matters? Because they will help students to systematically assess the community so that they might come up with a tailored solution. And last one is the benefits of the CRM. It's like we tell students, if you can design a context-sensitive, cultural relevant intervention, that the change might be can be last. Okay. So what community readiness is assessing CRM evaluates 6 dimensions: community knowledge of the issue, to measure, to assess whether the resident or the leader of the community, they really understand what you are talking about, whether this issue is important, the awareness. And the second is, do they know the community had already done some effort? Whether the leader had done some program, but the resident didn't know. So whether they know about the existing effort. The third one is the leadership. Whether there's a leader, they are enthusiastic to pursue such effort. And that is and then the community effort. Would they actually have done anything about this issue? And then the community comment, whether people in the community go for this issue or against the issue. The overall atmosphere of the community related to the issue. And that's what the resources. Will they have money? Will they have project? Will they have volunteer people who can do that? People who are so enthusiastic about the safety of the community. So overall, in this overall 6 dimensions, if we use it properly, we might have some idea about the community, which whether they are aware of the issue you are concerning, and then probably get a better idea of how to pursue your engagement with the community. So now I will show you an application of the CRM on dementia prevention. So this is a study I work with my student. The word of dementia, I think everybody knows how important dementia, especially they affect among older adults. So, and according to the survey conducted by the government in 2011, but they have already has a new survey in 2022, and the result looks similar. Most of the majority of mild dementia patients live in community, and most of the care burden are in their family, so they are in the community. But if the community have dementia patient or mild dementia patient, and they are not aware of the importance of the issue, sometimes you can see it create a lot of prejudice or misconception, and they don't have if they don't have like a collective advocacy as a community collective action tendency. Sometimes the people in the community, especially dementia patients, are willing to come up to seek treatment, and also difficult to secure resources, community assets to help the intervention program. And also, the most important, it will increase the atmosphere of indifferences. So those are things we don't want it. So since 2017, our government has promoted a program in community to promote like a dementia-friendly community. Only 2017, and in Taipei it's only coming like 2020 have a program. So are we ready for dementia-friendly community? Do we have awareness? Do we have a capability to eliminate stigma? Or can we engage people in the community to go together to design a better environment for aging, for older adults? And as you know, Taiwan will become super aging society, projected in next year. Okay, so what we do, we use the CRM, but what I'm going to share is I use more quantitative and special method, because previously always used like an ASPER approach, more like a qualitative approach. Like we go to the community with an ASPER group, a work team, and then evaluate the environment based on their observation, based on their interviews. But here I take a different approach. I use more quantitative and more spatial econometric method. And so we come up, because CRM is more issue specific. You find out which issue you are particularly interested, and then you create a measure. So we ask experts to come up a measure for CRM, including knowledge, including like community climate, leadership. Like for example, for the community climate, they ask whether the member of the community can allow individual with mild dementia to work as a catering service, or like leadership, like whether a community leader will contribute money to support initiative and at preventing and slowing the progress of dementia. So that's the leadership. Or resource, like whether the community can provide enough volunteers to promote activity to prevent dementia. So these different items that will come up to measure community readiness, especially for dementia prevention. Okay, so we have done a survey during 2021. We cover, we do a mail survey to the community leaders. There's because when we done the survey, it happened in the COVID-19 period. So they are so busy with trying to get help with the community. So we only have 487 community leaders. They filled out the mail questionnaire. And however, we look at the different neighbor of the community. We still have like an average 2 leaders who answer the questionnaire for each community. So in total, like we have like 63% of the community who have the representative, who have data for the CRM measure. And then we come up with like what exactly the community will look like when we really use the 6 CRM measure to measure our community. And then we come up with like 4 clusters. The first cluster is about the majority of our community is cluster 3. So it's kind of well balanced, but however, the score is not it's not the highest. The highest score of CRM is the cluster 4, and then the second is the cluster 2. So cluster 1, about 30% of the survey community has a very strange size, right? Very small size, and the majority, 47% of the community look like a cluster 3, well balanced but relatively small. And if you overlap this cluster, you can see there's still a large part not doing so well. For example, climate, community climate and the knowledge part. So even those higher score CRM community still not very balanced. So, and then we come up, the second question is whether the community social support, collective advocacy from sociology of resilience will be associated with a higher CRM score. And then we also come up with a measurement from literature. We come up with social support willing to help each assist. Like if someone falls on the roadside, with a member of the community will assist. And if elderly get lost, a member of the community will assist. I mean, and the second one, willingness to intervene in the community cohesion, coming from a sociologist, Simpson, American sociologist, Simpson, and they designed a concept of collective advocacy to show how the community member were willing to help, willing to intervene when something happened in the community. So for example, willing to intervene is like we asked if someone encounters a violent conflict or something, a disturbance, people was intoxicated, people drink too much and they start fighting, or people who damage the environment. Would anyone in your community will call, will die 110 in Taiwan, call police to, or try to escalate the tension. And the community cohesion is measure their mutual trust. They were closely tied with each other. They are willing to help, willing to interact with each other. So it's like a different nation. Okay, so because this is the ecological level and regional data, so we try to see whether the regression is okay. But then we found out there's a high tendency of autocorrelation. So we run a spatial autoregression model. And then as you can see that the factor predictor, significant positive predictor of CRM, we take a Z-score, is willing to intervene. One of the aspects of collective efficacy. And the second is communication, community cohesion. And the third one is the community previous effort, presence of a dementia prevention program. And last one is the neighbor's CRM score. So if neighbor has higher score, that through the interconnected will increase the community's readiness score. So with this information, we try to project whether there is a spillover effect for this significant factor. So as you can see that this is the overall impact if one unit increased in this variable. So you can see that for the cohesion, the Y bar is the number of the community. The X bar is the global spillover effect. So as you can see that the cohesion has very, and the willingness to intervene, they all show that there's a lot of community have a small amount of spillover effect. And but for the previous community effort, so if the community had a dementia program before, and the spillover effect is relatively large effect. But however, as we can see that collective efficacy still play a role in the effect of the spillover effect. But however, social support doesn't come up in a significant effect. So in the discussions, we using this example, we have uncovered the distinct trait of various community clusters. We found that community with a stronger willingness to intervene and the community cohesion are more adequately equipped with to manage dementia-related concern. And we identified a special spillover effect in suggesting that an increase of one unit in the community collective efficacy could enhance community-wide readiness for dementia prevention. And for the cluster one, you can see that this cluster includes 37 communities. We believe this cluster is something we should put more intervention resource in this community, because as you can see, they have the little awareness, and there's the climate is not so friendly to dementia. So how do we get into each community and using the participatory action approach, we might be able to create a more tailored public health strategy. And even for those communities with a higher CRM score, which means that they are quite aware of the issue of dementia prevention, and they quite put resources in the community, but there's still some parts need attention. So it's not well balanced. So now community climate knowledge is still something we need to put more efforts to it. And so the take-home message is from the previous study. We believe promoting social connectedness can for health equity. And of course, there are a lot of limitation, and in future direction, we hope that we can have a better sample and better more response, and then we can get more reliable result for the study. And we hope that we can also do more longitudinal study, and more based on the finding. In the future, we want to do more more participatory action such to identify a specific community, those that we can engage in with the community. Okay, that's about my presentation. Thank you very much.
Thank you, Dr. Chen. I love the long wish list that she just made. Next, we want to invite Dr. Chen to the stage to give us comment to discuss the presentation.
Thank you, Professor Chen, for a wonderful presentation. I know we're almost at the end. We're almost there, everyone. Certainly thinking about community, certainly I've been working with communities probably since I was a kid, you know, following my dad, who was an ENT doctor in Kaohsiung, and later coming to America, and at a youth crisis shelter as an adolescent, doing those 24-hour overnights as a peer youth counselor, and really, you know, thinking about, you know, communities and kind of, you know, the time to build trust, engage, and also being there, and also kind of learning from the different types of diverse communities. And here, even in Taipei, you know, all the different districts, and certainly across Taiwan as well. And, you know, thinking about, you know, training students is really part of our mission too. Here at NTU, College of Public Health, but also certainly UC Berkeley. In our vision, you know, we really want students to also be out there to make a difference, and certainly to engage communities for sure, and certainly thinking about those approaches, you know, kind of some of the challenges, thinking about, you know, empowerment or versus asset-based. You know, sometimes I feel like a tension or conflict between these two, you know. Us going there to try to understand or try to do something doesn't actually mean, you know, we can do anything. But really, it's the community needs to kind of take the decision-making or the lead, not us to empower them. So, but certainly, in some ways, we may have some skill sets or some capacity to help. And certainly, we should certainly work with whatever the capacity that the community comes with. Any community, as I said earlier, challenged, disadvantaged communities are very rich. Even Allensworth, where I was, where Pastor Dennis's mom moved back to Allensworth in 1979. Before that, there was Allensworth was kind of a ghost town after Colonel Allensworth passed away, and some of the African American families moved out in maybe in the 30s, 1930s. And it started to come back in the 1970s with some the former families that used to live there coming back to try to make a difference in the new farm worker families. So trying to kind of those relationships, you know, as the students go out there, and then later, you know, Pastor Dennis decided to try to help the mom to move back to Allensworth, and later Coyote, another of his friends, came and moved over to address the issues of the arsenic in the safe drinking water. So likewise, you know, going to communities, you know, it's not easy. You know, it's very much a challenge, and kind of some of my work with students. Also, just this morning, from 7 to 9, I had my last class of the semester on Zoom. And students presented it because I required them to do a community service project. And you got to go volunteer out there. I can't teach you this. You go out there. You know, spend 25, 30 hours each student in groups of 5 to do something. And one of my students, you know, helped at a place with a YMCA in San Francisco Chinatown. After school programs, Saturday afternoons with elementary school kids, 2nd to 5th grade, teaching English, math, culture enrichment, and one other thing. And also a group of students going to a senior center, North Berkeley Senior Center, volunteering doing activities. Really fun listening to their great work. Students, you know, let them decide where they want to go, and, you know, kind of show them the way. So community readiness, you know, this is a good approach to kind of start to build. And perhaps, maybe for me, I would try to kind of engage with groups that I'm more familiar with, communities I want to, I have a passion about. Maybe it's a good starting point. I mean, after 25 years of doing this, I'm not as worried about going to a community I'm comfortable with. I can go with any community. But it starts somewhere, to build with something you're comfortable with, a community you have a passion about, and kind of take the time to connect. And certainly for me, it's also volunteering at the Chinatown Newcomer Services Center for newcomers. And spent a whole month I was volunteering there, trying to be with them. And that's how I learned initially. And certainly, thinking about issues of dementia, and families, and it's a very difficult issue. And certainly, it's important to try to, this is an important issue in Taiwan, and certainly in many communities. And think about my aunties who are in their 80s now, and my mom, and also one of my aunties in the 90s. Everybody has dementia, and it's a very challenging moment for many of my aunties. I visit them, and they just don't remember anything, or they might remember me as a 10-year-old. So, different things. And all of the relatives, my cousins who are trying to help their older adults, parents, have these challenges. And I think, it's so important if they're with this community readiness to identify places where we really need dementia programs or more dementia programs in different regions. So I think, there's wonderful opportunities. And I think certainly it also makes me think of some of these community cohesion. Renovate talks about the strength of weak ties and really kind of social capital, but really, there may be different people in the community, maybe an auntie or a neighbor who also can help. So it's really cobbling up together, neighbors being neighbors, and kind of also, having dementia programs. And certainly, it's a very difficult moment for families to want to share, because it's a stigma to share having a mom or a dad with dementia. So, it's a moment of truth, for adult children to really step up and kind of move forward and have the community to help their parents who may have dementia. So these are trying moments, but certainly, building up. So looking forward to future work that your next steps, Professor Chen, on this project. Thank you.
Thank you, Dr. Chen. So I would like to open to one question maybe from the audience. Do we have any questions? Andrew, and then Sylvia.
I wanted to thank for very interesting talk. I wonder, today we raised the question about immigration. And for example, Taiwan birth rate is very low, but population increases. So I wonder if someone among immigrants would have dementia, and then this person could be in an unknown country and probably does not speak Chinese or English. Is there any way to incorporate these people also in this kind of programs? Or any class from the region power? So this is what I was wondering.
Yeah, I think this question is very, very important for if immigrant, if they are enrolled in the national health insurance system, and they have such dementia, and they can get the system will get help. They can get help from the system. Yes, that's true. But if the immigrant is not registered in the national health insurance system, whether it's illegal or something. Yes, of course. The community program is something the government has established. The community community dementia prevention program in the community. Right? They put the money in the community so that if the community develop like organization, they want to become dementia prevention program, they can apply for the money to do the help. So they have come up with different agenda, different activity to help. And if the immigrant in the community, they come to the center, if they come to the center and they can work, then they can get some help. And someone will come to the person and to give some, to enroll the person to the program and give some work, some participate in the activity in that program.
Thank you so much. I really loved your research, and I feel like I found a 中文讲知音，做这个东西。You understand my music, something like that. I'm curious because your conclusion about promoting social connection or connectedness, I think that's such an underappreciated area of health, public health, and health promotion. How do you measure outcomes? What are some of the ways we can say this program is working? And I know you also look at spillover effects. I think that's excellent. I'm just sort of helping me to think about, because I think social isolation in the U.S. context is a growing problem. So if you can teach me a little bit about how you measure these things, that would be really great. Thanks.
You measure social connectivity.
Self-reported?
Yes. As I said, because when we do the community study, there are always two kinds of way of data collection. So one way is collect data from the residents. So the other way is collect data from the community leaders. So we distribute our questionnaire to the leaders. Because in order to collect as many as questionnaire possible, so we distribute a lot of questionnaire to different kinds of leaders. In Taiwan, we have a leader, administration, and the leader is elected, by people. And then we have 领长, and the 领长. The 领长 is the also administrative officer kind of. And then we have community development organization association, and there's a leader for this organization. So we distribute our questionnaire to this leader and collect information from them. And for the way I say collective efficacy, the measurement including two parts. One is the measure social cohesion. So they report whether their residents help each other. I know this is also a process because it's difficult to collect all the information from all the residents. Right. So they said they will tell me whether the residents help each other, whether they close tied to each other. That's cohesion. And for the willingness to intervene, willingness to assist, they will perceive their residents whether they will help. If there's something happening in the community, whether they will help. So it's like an average score from the leader in the community to come up with a measure.
Thank you, Dora and Winston. I think we are running out of time, so feel free to stay for more questions and discussion. But otherwise, I think I'd like to conclude our session today. Thank you both. I hope today's sessions are fruitful and helpful, and I hope you guys will enjoy it. And I do hope that the discussion today will stimulate future thoughts and further actions. And action. We will all do good in health equity, and we will all working on it. Thank you very much for coming. Thank you.